I'm going to present intra-articular inflammation and catabolic markers in femoral acetabular impingement during progression of disease. Our disclosures can be found at the American Academy website. FAI is considered to be one of the main causes of articular cartilage damage and early hip osteoarthritis in the young adult. Cartilage from the impingement zone in FAI has a high catabolic profile with increased expression of inflammatory molecules. However, little is known about the location and progression of intra-articular inflammation in FAI hips. Previously, our lab have shown that if you would compare the cartilage from patients with CAM FAI to patients with advanced arthritis, these two groups will present an articular cartilage with similar phenotype. And this is basically an osteoarthritic phenotype with severe degeneration of the tissue. Even more, if you will also look for the amount of inflammation that these patients present in the head neck area, and you will compare both groups, the CAM FAI to advanced arthritis, we found that the expression of inflammatory markers were very similar between groups. However, during this study, we did not assess for inflammation at other locations of the joint. So the next step was basically to characterize inflammation and catabolic markers in the head neck and also acetabular cartilage obtained from patients with FAI CAM and late advanced arthritis. Secondary, to characterize the degree of synovitis and inflammatory markers in the synovial tissue from these two groups. The hypothesis was that early stage FAI has similar expression of inflammation-related markers in the head, neck, and acetabular cartilage, but less synovitis than in those patients with advanced arthritis. Methodology included basically 30 patients. We had 15 patients from the early FAI or those patients with FAI CAM and no arthritis, and it was compared to late FAI or those patients with advanced arthritis secondary to arthritis. In these patients, we obtained 3 samples. One was from the synovium, then we obtained cartilage from the head neck area, and also from the acetabular cartilage. As a control, we used femoral head from fresh osteochondral allografts. What we studied in these patients was basically the structure of the tissue using a safranin staining, and we also studied the inflammation through expression of inflammatory markers such as IL-1, MMP13, and ADAMS4. We basically observed in these 30 patients here the demographic of the groups. In the early FAI, we had 15 patients. You can see here that, of course, these patients were younger because this group was the group that did not have arthritis, compared to those patients with late FAI or FAI with arthritis, where the age was significantly older. Radiographically, we confirm impingement on both groups using the alpha angle. You can see that both groups, there's one alpha angle of more than 55 degrees, and the Tony's classification confirmed that there was no arthritis in the early FAI and there was advanced arthritis in the late FAI. In regards to the results in the head neck cartilage area, we did see similar results to what we have observed in our previous study, where we basically saw that the head neck cartilage from both groups in early FAI and those patients with advanced arthritis, there was severe degeneration with an osteoarthritic phenotype, and this was quantified with a Mankin score. In regards to the inflammation, we saw also that the amount of inflammatory markers that were in both groups were very similar, confirming that the inflammation that we see in patients with advanced and early arthritis is very similar. When comparing the acetabular cartilage, we also saw that the inflammation was very similar between both groups. So the inflammation that was observed in those patients with FAI CAM was very similar to what we observe in patients with advanced arthritis, and this is nicely represented in these graphs. However, interestingly, we saw that the degeneration that we observed in the acetabular cartilage was even worse in those patients with early FAI compared to those patients with advanced arthritis. In regards to the synovitis, we did see a difference between both groups. Basically, we saw that patients with early FAI only presented mild synovitis, where those patients with late FAI or patients with arthritis, there's already a huge inflammation that is going on in the synovial tissue. In regards to the expression of inflammatory marker interleukin-1, we also saw that the expression was significantly lower in those patients with FAI when compared to advanced arthritis. So in conclusion, the cartilage from the impingement zone of hips with CAM FAI at both early and late stage disease is markedly degenerative, showing an osteoarthritic phenotype. They also have a high expression of inflammatory and catabolic proteins. However, severe synovitis was only observed in the late stage disease or in those patients with advanced arthritis. This study supports the concept that early hip impingement is associated with cartilage degeneration and catabolism. I want to thank first all our hip research team here in St. Louis. I also want to thank the ORF Boulder Research Run for supporting this study. And I want to really thank my postdoc, Masahiko Haneda, who has done incredible work with this study. Thank you very much.